New York City Health and Hospitals aim to reduce unnecessary testing and treatment with the High Value Care Initiative.
High value care can be looked at in a couple different ways. One is in terms of the definition of value. So you can increase the quality or outcomes and reduce the cost. But the second way to look at this is in terms of overuse and reducing it. So overuse is defined as any service that we do where the harms outweigh the benefits for the patient.
An estimated 20% of healthcare services are considered overuse or low-value care and can cost up to $100 billion yearly in the United States. Overuse also leads to physical, psychological, and financial patient harm. New York City Health and Hospitals leadership recognized that unnecessary follow-up appointments or blood tests can burden patients in underserved communities, and administration of certain procedures at night can disrupt patients. The health system targeted 8 low-value services in the inpatient setting and took a novel approach to making a difference in patient experience.
So our focus was really three-pronged. First, you have to get buy-in from the providers actually using these tests. So we created a multidisciplinary group in which those providers actually came up with the recommendations. The second approach was actually using education to spread awareness about these low-value services. And then we used the electronic health record to basically nudge providers to do the right thing. So this included having a few sentences on these orders that told you why you should not order these tests and which specific circumstances they're indicated.
As a result, New York City Health and Hospitals saw a significant system-wide reduction of 8 targets and complete de-implementation of 2 targets measured for 1 year post-intervention. These interventions saved an estimated $3.5 million in charge costs and reduced the risk of patient harm.
And a lot of times when we talk about high-value care, a lot of people associate that with cost, which is of course important, but our focus is really on those harms.
Given this successful intervention, New York City Health and Hospitals hopes to expand the initiative.
I think we can go so many different directions from our successes. We've only scratched the surface in terms of labs and affecting sleep. I think there's medications and radiology that we haven't touched. I think there are sort of the subtle things also that we want to activate. So engaging patients, having that conversation about overuse and even about cost with our patients. I think that's a huge area that we want to explore.